As a result, the Action for Family Planning Committee was set up to try to advise migrant women on the need for contraception. In 1978, a factory visiting program was started, where women workers were shown a film about contraception and encouraged to talk about their family planning problems. Our Scoop camera crew went along on one such visit to a factory in North Melbourne.
We've come from Action for Family Planning, and we want to show you a film about family planning. Unfortunately, for those people who don't speak much English or understand much English, it is in English. After the film is shown, you'll have the opportunity of speaking with women who are speaking other languages. The film is called Hope is Not a Method.
This is typical of one of the factory visits made by the Action for Family Planning groups. It is the second of 3 visits which will be made to this factory before the team feels satisfied they've done their job. Each visit starts with a film, which is not only a good teaching device, but helps to break the ice on this delicate subject.
Well, originally a survey was done that showed that migrant women were overrepresentative in the women that looked for abortions in hospitals.
What did you know about contraception before today's film?
I've known the pills.
You only knew about the pill. Did you think it was a good idea, them coming along today to talk to you?
Yes.
Have you learned something?
Yes.
For most young people, the rhythm method alone is not effective.
What did you know about contraception before the film?
Only about the pill.
What did you think of it?
Oh, it's okay, but I wouldn't like to take it.
Take what?
The pill.
So you don't believe in the pill?
No, it's not that I don't believe it, just I don't like taking tablets, that's all.
But you do use a method of contraception?
No, at the moment I'm not using anything.
We find that about 7 out of 10 of the women that come to our clinic at the Queen Victoria Medical Centre are migrants, and many of these people in their home countries have used abortion as an accepted method of child spacing whilst at home. So it's very difficult for these women when they come to Australia and find that this is not the situation in this country.
11 migrant women, speaking 6 different languages between them, have been trained as lay educators in family planning. The groups discuss topics such as family planning, techniques of birth control, and where the nearest clinic is located in their suburb. At the same time, the women are encouraged to talk of their beliefs, experiences, and any problems they have related to family planning.
And it'll stop at 2. So 2 things are always better. But we thought that this was the place where women will be, particularly migrant women, because they make up a large percentage of the workforce in factories, and many of the women don't have time to look for this sort of information elsewhere, so we see them in their lunch breaks of half an hour.
And among many sex-active couples, the high degree of failure comes from errors in calculation and human weakness.
Because I think it's interesting to know all about this, especially for me because I'm single, I'm not married, and I think it's good for the future.
Rhythm can be Russian roulette. The losers get pregnant the first time.
What is your attitude to contraception?
I think they're very good in a way because before use came, we didn't know about all the things you can use, mostly the pills, so it's very good to know all the things. If you don't like one, you can choose the other one.
The winners get pregnant later and worry in the meantime.
What is the attitude amongst migrant women towards contraception and abortion?
Well, you can't generalise because each migrant group has a different culture and a different attitude. And that's why Action for Family Planning is training a number of women in all the different migrant groups. At the moment, we can only cover Greek, Italian, Turkish, and Yugoslav, and Spanish. And until we get the funding, well, we can't really expand into the other communities. But we find that some groups have never seen the diaphragm, and they're very interested. And the idea is to give them the information so to know where to go, so that when they go, they know what to ask for.
Many of these women may not have even tried to seek information on birth control before today. Many do not have time to visit clinics outside working hours. On top of that, there are the language and cultural barriers to overcome. By going into the factories themselves, barriers like these are broken down.
There are many migrant women coming to our clinic looking for abortion. I think perhaps the main reason for this is that, well, as an extension of what I said before, they haven't been tutored that abortion is not acceptable. They haven't learnt that they need to use family planning methods that are more acceptable in this country.
Unfortunately, as vital as the program seems to be, it may all come to an end soon. To date, the program has been financed by a federal government grant of $20,000. In June this year, that grant expires. And as of when this film is going to air, the team still don't know if any more money will be forthcoming.
We have enough money only to complete 8 more factory visits at all between now and June. If we don't get money that we're anticipating and waiting for from the state health department and the federal health department, we will have to close our operations completely.
Sometimes we must go to the hospital and we must spend there all morning, and we have no time for ask them about another thing.
You don't have time to talk to them. They don't have time to talk to you.
We ask them, but they have no more than 5 minutes, and we can't know about that. Sometimes we need an interpreter, but they have not enough.
Did you learn from today's visit?
Pardon?
Did you learn from this morning's film and this visit?
I learned a lot. I know about them, but now I'm more clear.
There was a factory visiting program for family planning.